If you know anything about uric acid, it's probably because you have gout. Gout is formed by the accumulation of urate crystals in your joint, which causes inflammation and intense pain. Urate crystals can form when your levels of uric acid in your blood are too high. Your body produces uric acid when it breaks down purines, which are substances that are found naturally in your body. They're also found in certain foods and drinks, like steak, seafood, beer, and drinks that have been sweetened with fruit sugar. Uric acid is supposed to dissolve in your blood and pass through your kidneys into your urine. But sometimes your body ends up producing too much uric acid, or your kidneys don't excrete enough uric acid as waste. This can cause a buildup of uric acid, which forms sharp crystals in a joint or surrounding tissue, resulting in a lot of pain and discomfort. You're more at risk of developing high uric acid if you're African American, a man, or a person of older age. Other risk factors for high uric acid include alcohol use, certain medications, high blood pressure, and obesity. If you think you might have high uric acid in your blood, there are a few symptoms you'll most likely display. These symptoms usually come on suddenly, especially at night, and include intense joint pain. When your increased uric acid causes gout, it's common for this to affect the large joint of your big toe. With that said, it is possible for gout to occur in any joint. Some of the other commonly affected joints include your ankles, knees, elbows, wrists and fingers. You'll most likely experience a severe pain within the first 4 to 12 hours after it begins. Long-term discomfort. If you're experiencing a gout flare-up, even after the most severe pain goes away, you'll be left with some joint discomfort that could last from a few days to a few weeks. The longer your uric acid levels remain high for, the longer your gout attacks are likely to last for, and the more discomfort you'll feel in the aftermath. Inflammation and limited movement. Aside from pain and discomfort, another common sign of a gout flare-up is on the skin of your affected joint. The joint may appear swollen, tender, warm to touch and red. You may also experience a limited range of motion, especially as your gout progresses. Eventually, you might not be able to move your joints normally. Kidney stones. When you have too much uric acid in your blood, it can also cause kidney stones. This happens when uric acid crystals combine together into one mass. The stones are normally small enough to pass out of your body in your urine, but this isn't always the case. Sometimes, they become too big to pass and can end up blocking parts of your urinary tract, which can cause pain or aching in your lower back, side of abdomen. You may also experience nausea, an increased need to urinate, and pain while urinating. People with high levels of uric acid need to avoid certain foods that could make their symptoms worse. Foods containing purine can cause gout flare-ups, and are worth avoiding as much as possible. This is because when you eat foods that contain purines, your body breaks them down into uric acid. Let's take a look at the foods to avoid. 1. Liver. If you have gout, dishes like chopped liver and onions are best staying away from, along with other organ meats like kidney, heart, sweetbread, and tripe, as these are all high in purines. Instead, you should aim to include other meats like poultry and beef in your diet. These contain fewer purines, so you can safely eat them in moderation. You could also get creative with your cooking and try a vegetarian pate recipe made from mushrooms and walnuts. This provides the flavor of liver, but it's made with ingredients that don't aggravate gout symptoms in the same way. 2. Soft drinks. The sugar fructose in soft drinks isn't actually high in purines itself, but your body breaks it down to form purines. When you drink fizzy beverages made with high fructose corn syrup, you're putting yourself at a higher risk of gout. One study even found that men who drank 2 or more servings of fizzy drinks per day had an 85% higher risk of gout than men who had less than 1 per month. Switch up your full-fat fizzy drinks with diet versions. These drinks don't seem to be connected with gout in the same way, so they're a good option if you need help transitioning off the sugary stuff. Obviously, it's still not a good idea for your health to drink too many diet sodas anyway, so make sure you're also getting enough healthy hydration. Try water flavored with lemon and lime slices, or unsweetened seltzer in appealing flavors like passionfruit and vanilla.